There is another more advanced protocol that I encourage people to move toward, and that is on the downward stroke. We would generally start by letting the head go into extension, keeping the tongue and the frenulum, and letting the bar and the chin tension control the neck going into extension. And that would really open up the joints very well. Because so many people have compromised cervical curves, and there is so much pathomechanics of the motor units throughout the cervical spine prevalent on dynamic flexion extension stress studies in the cervical spine, I strongly encourage you to move toward an advanced technique in which, again, you keep your tongue and your frenulum, but you keep the bite line very, very straight. By doing it in this way, we're going to take the head and move it into posterior translation, in which trains the head to come back onto the center of the body axis, and it will also help to rehabilitate the tension in the upper thoracic spine and open up that thoracic spine, because as you lose the head curve and the head goes into forward head posture, this puts tremendous strain on the upper thoracic spine and precipitates hyperkyphosis with anterior head posture. So that type of protocol would be very, very, very beneficial to restore function as well as positional integrity of the head and neck over the central axis of the body.